Hi, I'm Steve. I'm here with Dr. Gallagher to ask questions about routine vision care and the importance of keeping your eyes healthy. Dr. Gallagher, could you tell us why it's important to see an eye doctor regularly, even if you don't notice any vision issues?
The obvious answer, of course, is to update your glasses if you have any, but a regular eye exam detects a lot of things from glaucoma to macular degeneration, even to the early stages of diabetes. So patients come in a lot of times with no previous diagnoses, and a regular eye exam can really help detect those things, hopefully early.
That's great. Now, could you tell me a little bit about some of the tests that are performed during a comprehensive eye exam?
So during a comprehensive eye exam, we look at the muscles of the eyes. We always check the eye pressure. We, of course, check any glasses prescription if there is one. And then we look at the front surface of the eyes. We look at the back surface of the eyes through a dilation, which is basically some eye drops that we use to be able to see the full area inside the eye.
Well, that's fantastic. Now, how often should an adult get their eyes checked?
So typically an adult should get their eyes checked every year.
Now, does that change with age or conditions?
It definitely changes with conditions, sometimes with age. Sometimes patients are in their older ages and are perfectly fine with just a yearly comprehensive exam. But there are definitely some conditions, maybe like glaucoma, diabetes, where we see patients more frequently, depending on the severity of the condition.
And Dr. Gallagher, here at Pasadena Eye Center, you have both optometry and ophthalmology. Could you tell me a little bit more how that team approach benefits the patient?
With optometry, we do a lot of primary eye care. So a lot of our exams are full comprehensive exams, and sometimes we feel it's necessary for a procedure to be done or a surgical procedure to be done. And that's when we really turn it over to ophthalmology, or sometimes just something that needs to be escalated.
Can you explain how you coordinate care with ophthalmologists such as Dr. Emery?
So with Dr. Emery, he does a lot of our procedures and surgery, specifically cataract surgery. And so when I see a patient and I feel that something needs to be done, as far as a procedure goes or surgically, is when I, schedule a patient with Dr. Emery for a follow-up.
So why is it helpful to have both medical and routine optometry under one roof?
It actually makes things a lot easier, not only for the doctors, but for the patients. A lot of times, being in a medical setting, I have the opportunity here to do a lot of testing just under one roof. So it saves the patient a lot of time from going back and forth to different providers, because we're able to just kind of condense everything into one building and get everything done here. And then we also have an ophthalmologist when needed.
Now, Dr. Gallagher, I'd love to ask you some questions about dry eye and specialty care. So what are some of the most common causes of dry eye, and what are some of the diagnoses you see?
So with dry eye, we're really talking about a whole umbrella of ocular surface disease. Every patient really has a different root cause for their dry eye. A lot of times multiple different root causes. And so it really takes an eye exam to kind of pin down what exactly is causing a specific patient's dry eye. But it could be a number of things like just tear film insufficiency, so just simply not producing enough tears, or an issue with their oil glands. So when we don't have oil glands, there's no oil protecting our tear film from just evaporating right off the surface of our eyes. Coming in for an eye exam, you can really help determine what the cause is for each specific patient and get them the best treatment plan.
That's great to hear. Now, could you tell me a little bit about what treatments are available for dry eye?
Yes, so there are a number of things. Sometimes it's just an artificial tear, and being consistent with that is sometimes all you need. But a lot of times it's not, right? You're still getting that burning, that tearing, that grittiness, that redness. And so that's when we kind of have to jump to the next level there. And there's, prescription eye drops that we have that can help long term, help deal with the dry eye symptoms. We also have some procedures like the MIBA which really target the oil glands that we have in our eyelids, and just to help that oil kind of clear out so that oil is more freely producing into the tear film.
I've actually also heard about specialty contact lenses. Is that something that could help? And if so, could you tell me more about that?
So specialty contact lenses, specifically sclerals, are great for dry eye, really reserved for rather severe dry eye. Scleral lenses are an insertion and removal process, but a lot of times patients that aren't getting relief through other means of dry eye treatment can succeed in a scleral, because a scleral lens basically just holds a reservoir of fluid over the cornea throughout the whole entire day. And so it tends to be a really good option when you've kind of tried everything else.
So Dr. Gallagher, how do optometrists help prepare patients for cataract surgery?
So really every practice has their own flow and how they do things in preparing patients for cataract surgery as far as optometry and ophthalmology goes. Here, the optometrists really help a lot in the post-operative care. So just making sure the patients are taking their drops after surgery like they should be, and like their vision is adequate and everything with the surgery went well. But like I said, it can really vary from practice to practice.
So Dr. Gallagher, what role do you play in monitoring the eye before and after a surgery?
Before cataract surgery, I always make sure that the ocular surface is up to par before a patient goes into surgery. So we want to make sure that underlying dry eye is addressed before having a cataract surgery done. A lot of times patients will get dry eye symptoms and after cataract surgery and think that it's the cataract surgery that caused it. And that's not the case at all. 9 times out of 10, there were underlying dry eye already present that just wasn't addressed. So really doing that ahead of time and being proactive rather than reactive can really save a patient from ocular discomfort in the long run. So that's what I do a lot here, is just making sure I address that ocular surface before a patient goes into surgery. And then after surgery, just making sure a patient is taking their drops like they should. Everything went well with the surgery. Sometimes that lens needs to be polished up. At some point it will. And so I monitor for that and just let the patient know when that time has come.
How would you determine if a patient is at risk for eye disease such as glaucoma, macular degeneration, or something similar?
Specifically with glaucoma and macular degeneration, there is a rather strong genetic component to it. So family history is one part of that. However, it's not everything. Really, a comprehensive eye exam and getting that patient dilated and taking a good look at the macula and the optic nerve are the best ways to really determine if there's anything out of the norm going on inside the eye. Sometimes the optic nerves might just look a little bit larger than average, and that prompts me just to get a scan, easy, non-invasive, quick scan. Detects glaucoma very early. Our technology is great these days for that. And same goes for macular degeneration. So sometimes, if you see a little bit of buildup on that macula, you have any sort of thought that maybe there's some macular degeneration happening, just getting that quick scan really is the best course of action.
Now, sometimes when it gets to conditions and diagnosis, there's all these words and it gets a little hard to understand. Do you find that you have a special way to help the patient understand these conditions and diagnosis in a way that's easy for them?
Yes, that's part of being a good clinician, and every day I feel that I am trying to refine the way I'm speaking to a patient or the way I'm teaching them and helping them understand what's going on. So that's always a learning process for me as well. I try to explain things as simply as possible, and if the patients ever have questions, I always make sure I answer those.
Now, a lot of times in optometry and medical optometry specifically, there are a lot of options for treatments. Is there a way that you help the patient decide what treatment option might be the best for them?
Yes, when it comes to treatment options, whether it's, let's say, glaucoma, there's different approaches you can take even as first line. Sometimes a simple laser might bring down the pressure. Sometimes the option might be surgical. Sometimes the option might be an eye drop every night. So there are always different options, and really I want to make sure that I give the patient every option that they're a candidate for, and even the options they're not a candidate for, and letting them know why they aren't a candidate for those options, and then deciding with the patient what they feel is best for them.
Dr. Gallagher, what are some of the best ways patients can protect their vision at any age?
So sunglasses are good, no matter who you are, what age you are. I know it's hard to get toddlers in sunglasses, but really sunglasses are always good to be wearing. Just, help prevent the progression of cataracts. We'll all get them at some point, but it'll help slow it down a bit. Also helps protect from macular degeneration. Green leafy vegetables are great as well. Everyone seems to think carrots, which they're good. I won't discourage you from eating carrots, but green leafy vegetables are really great for the health of the macula in particular.
Now, are there things like that you recommend to patients in between visits? Lifestyle habits, things like that. Is there anything else that you could recommend?
Yeah, absolutely. So those are the two big ones that really all of us should be doing. But in particular with dry eye, really the environmental factors do play a big role in dry eye specifically. So you want to make sure, air conditioners aren't blowing on your eyes too much. I know that's, in Florida with the car air conditioning. Yeah, that always gets you. Luckily it's humid here, so that does help. Other than that, just Staying hydrated,
Okay.
omega-3s, fatty fish, salmon, those are great things just to keep your eyes hydrated.
Well, thank you, Dr. Gallagher, for answering all of my questions. I hope that helps other patients feel more confident about getting their eye care here at Pasadena Eye Center. And I know I'm looking forward to our upcoming appointment.
Awesome. Thank you so much, Steve.
Be sure to check out our upcoming Sight 360 shows.